My name's Emily, and I'm going to be demonstrating how to give an intramuscular injection. The first thing I would do is check the doctor's order, and the doctor ordered 0.4 milliliters of sterile water. Then I would check to make sure the patient doesn't have any allergies to the drug. Then I would gather all of my supplies. For an intramuscular injection, you can use a 19, 20, 21, or 22 gauge needle with a length of 1, 1.5, or 2 inches. For this injection, I'm going to be using a 3 milliliter syringe and a 22 gauge needle at 1.5 inches. I would pull my drug and I would check the expiration date, and I want to check the vial, make sure it matches what was ordered. I want to check that when I pull it from the supply, when I'm drawing it up, and at the bedside before it's administered to the patient. So I would wash my hands, and then I would clean the top of the vial. And while that dries, I want to remember the 6 rights to drug administration, including right patient, right dose, right drug, right time, right route, and right documentation. So I draw up the 0.4 milliliters of air, and I would inject that into the vial, and then I would draw up the 0.4 milliliters. You want to make sure that there's not a ton of air in the syringe. So you recap, make sure all the air is out. Then I would switch my needle. Okay. And then I would label it with what the drug is and how much is in there, and then who it's for. I would take it to the patient's room. I might also take with me an antidote if one is available for the drug. I would enter the patient's room. Hi, my name's Emily. I'm going to be giving you an intramuscular injection that was ordered by your doctor. Are you allergic to any medications? I would check the patient's wristband. Can you tell me your name and date of birth? And then if necessary, if any focused assessment needed to be done before administering the drug, I would do that. The injection sites for an IM injection include the deltoid, about 2 fingers from the acromion process. The vastus lateralis, you'll put one hand on the upper thigh, one right above the knee, and you want to give it on the side of the thigh in between your hands. The ventral gluteal, you'll place your hand on the trochanter, making a V, and you want to give it in between your fingers. And then the dorsogluteal, the upper outer quadrant of the buttocks. So I would wash my hands, and then I would apply the gloves. I would be sure and clean the site for about 30 seconds, making sure it dries completely. With an IM injection, you can pull the skin taut, or you can pinch it up. So I'm going to pull it taut with a dart-like motion, about 90 degrees. Inject it. You're going to release the skin and inject the medication. And then you would dispose of the needle in the sharps disposal.